The anesthesia doses were enough to render him unconscious, but 31-year-old factory worker Ethan Carter was still speaking on the operating table. "Nurse Emily, my blood pressure is 92/58, pulse 115, oxygen saturation 98%, Ethan said in a steady voice. Emily glanced at the monitors, confirming his numbers were spot on. But those monitors were out of Ethan's line of sight. "Ethan, how can you see those monitors?" Emily asked, puzzled. "I'm not seeing them from my body, Nurse Emily. I'm watching from above, near the ceiling. I can see you all working and my body lying there." This defied medical logic, yet Nurse Emily had witnessed something similar before, Syria, 2020, in a field hospital. Welcome to Untold Mysteries. Drop a comment below with the city you're tuning in from, and if you think stories like this need to be shared, hit that subscribe button. Emily Harper had been an operating room nurse at Mercy General Hospital in Denver for 4 years. At 36, Emily was known among her peers as unflappable, dependable, and remarkably skilled. She stayed composed in the most intense emergencies, never missing a beat. "Emily's medical insight goes beyond what most nurses know," said Dr. Rachel Nguyen, the lead trauma surgeon. "Her assessments are almost eerily precise." But Emily's exceptional talent wasn't just from standard nursing training. For years earlier, she had left military life behind, keeping her past under wraps. Emily's approach stood out. While other nurses stuck to routine vitals, she conducted thorough, almost investigative checks. "Why do you examine so closely?" colleagues would ask. "Just a habit," Emily would reply softly. But this habit was forged in far more extreme circumstances. Emily Harper's true story began 18 years ago. At 18, she enlisted in the military, starting with basic medical training. Her aptitude led to specialized courses, and she became a combat medic, part of an elite unit trained to handle extraordinary medical scenarios. Her first posting was at a field hospital in Iraq, treating injured troops, assisting in urgent surgeries, and making split-second life-or-death calls. Emily's real strength lay in tackling cases that defied medical textbooks. During her second tour in Afghanistan, she worked with special operations teams in remote areas, stabilizing soldiers with minimal equipment. Her skills were vital to mission success. Her third assignment involved covert operations near the Turkish border, classified medical support for high-stakes missions, keeping elite operatives alive in hostile zones. This role honed Emily into a top-tier medical expert. The moment that transformed Emily's life happened in Syria in 2020. She'd never forget Sergeant James Sullivan, critically wounded in a mortar attack and rushed to the field hospital. Standard anesthesia was administered, but James remained aware. Not only awake, he described the operating room in vivid detail, using precise medical terms and even detailing his injuries. "Nurse Emily," James had said, "I've got a hemothorax in my right lung, a grade 1 laceration on my left kidney, and my spleen's intact, but there's a tear in my liver." Emily was stunned. His account was medically accurate, yet surgery hadn't started. "James, how do you know these terms?" she asked. "I don't know, Nurse Emily. I just see it, like I'm outside my body, looking down." That day, Emily encountered a phenomenon beyond medical explanation. Military records called it traumatic out-of-body awareness, a rare, enigmatic condition with scant documentation. After her discharge in 2022, Emily transitioned to civilian nursing, supported by therapy and career counseling for PTSD. Nursing was a natural fit. She could keep saving lives. When Mercy General hired her, Emily's credentials were almost excessive: a nursing degree, combat medical experience, and advanced certifications. The hiring board at Mercy General hadn't probed too deeply into Emily Harper's background. For 4 years, she'd worked at the hospital without encountering anything extraordinary, and the eerie incident from Syria was fading into memory until Ethan Carter arrived. On Thursday, October 12th, at 3:10 p.m., Ethan, a 31-year-old factory worker, was rushed to the ER after a workplace accident. A heavy metal beam had fallen, striking his chest and abdomen. Conscious and alert, significant blood loss but stable, the paramedic reported. Ethan was wheeled into a 3, where Dr. Rachel Nguyen would lead the surgery, with Emily on the team alongside anesthesiologist Dr. Michael Chen, surgical resident Dr. Laura Bennett, and another nurse, Amanda Reed. When Ethan reached the operating room, he was in pain but communicative. "How are you holding up, Ethan?" Emily asked as they moved him to the table. "I've had better days," Ethan replied with a faint grin, "but let's get this fixed so I can get back to my crew." Dr. Chen began administering anesthesia. Ethan's vitals were concerning but manageable: low blood pressure, elevated pulse from blood loss. "Emily, prep 3 units of O-negative," Dr. Nguyen ordered. "We'll need to act fast once we see the damage." Dr. Chen started the anesthetic agents, expecting Ethan to drift off within 30 to 60 seconds. But 3 minutes later, Ethan was still talking clearly. "Dr. Chen, is there an issue with the anesthesia?" Dr. Nguyen asked. "No, everything's standard. Some patients process drugs differently. He should be out soon," Dr. Chen replied. Yet Ethan remained fully awake. Dr. Chen upped the dosage to levels that should have guaranteed unconsciousness. "This is highly unusual," he admitted after 5 minutes. "He's had enough to knock out anyone, but he's still responsive." Not only was Ethan conscious, he seemed sharper as the drugs increased. "Dr. Nguyen, I can feel what you're doing," Ethan said calmly as the surgeon prepped for the incision. "But it's not painful. It's like I'm watching from outside my body." This was medically impossible. The anesthesia should have rendered Ethan unable to speak or react. Instead, he was conversing normally. "Ethan, you shouldn't be able to talk right now," Dr. Chen said, baffled. "Let me try another approach." He administered additional sedatives through Ethan's 4, drugs that should have worked instantly. Ethan's vitals held steady, yet he remained fully alert. "I know this sounds odd, Dr. Chen," Ethan said, glancing toward the monitors, "but my blood pressure is 92/58, pulse 115, oxygen saturation 98%. Emily checked the screens. His numbers were exact, but the monitors were positioned behind and above him, out of view. "Ethan, how can you see those monitors?" Emily asked. "I'm not looking from my body, Nurse Emily. I'm seeing from up there, near the ceiling. I can see you all working in my body on the table." Dr. Nguyen faced an unprecedented dilemma. Ethan's vitals suggested he was physiologically under anesthesia, stable blood pressure and heart rate, but his mind was fully awake. "Ethan, you're saying you feel no pain despite being conscious?" Dr. Nguyen asked. "That's right, Dr. Nguyen. I can see everything, but there's no discomfort. It's like I'm floating above, watching you work. Are you okay with us proceeding with the surgery in this state?" "Yes, please go ahead," Ethan replied. "I can see the internal bleeding. You need to fix it fast." His words were alarming. Ethan was describing injuries that wouldn't be visible until Dr. Nguyen opened him up. Dr. Nguyen exchanged looks with Emily and Dr. Chen. "I've never seen this before, but we can't delay. His injuries are critical," she said. "Are you sure, Rachel?" Dr. Chen asked. "Operating on a conscious patient goes against every protocol. His monitors show he's physiologically under," Dr. Nguyen replied. "If he's not in pain and consents, we have to save his life." At 3:40 p.m., Dr. Nguyen made the first incision across Ethan's abdomen. Throughout the procedure, Ethan provided real-time commentary, describing surgical steps and injuries with uncanny precision. As Dr. Nguyen explored his abdominal cavity, she found severe damage consistent with the trauma, heavy bleeding from the liver, a ruptured spleen, and tears in the small intestine. Ethan had described these injuries before the incision. "Dr. Nguyen, the worst bleeding is from the upper pole of my liver," he said calmly. "There's also a grade 2 spleen laceration near the hilum and 2 perforations in my ileum, about 15 centimeters apart." Dr. Nguyen paused, stunned. Ethan's descriptions were not only accurate but used precise medical terms a layperson wouldn't know. "Ethan, how do you know these terms?" Emily asked. "I don't know, Nurse Emily. I just see it clearly from where I am, and somehow I understand it." Dr. Bennett checked Ethan's chart: high school education, factory worker, no medical training. Yet Ethan continued displaying impossible knowledge. As Dr. Nguyen worked to repair his liver, Ethan suggested, if you approach the hepatic artery from a slightly anterior angle, you'll get better control of the bleeding without risking the bile ducts. Dr. Nguyen glanced at Emily, bewildered. Ethan's suggestion was surgically sound, reflecting an understanding of anatomy that typically required years of study. As the surgery continued, Ethan's insights grew more astonishing. He predicted every finding before Dr. Nguyen reached it, assessed tissue viability accurately, and suggested techniques that proved effective. Emily flashed back to Syria, to Sergeant James Sullivan, the same inexplicable awareness, the same precise medical knowledge, the same watching from above. Ethan, have you ever been around surgeries before? Emily asked mid-procedure. Never, Ethan replied. I've only been in a hospital once, when my son was born 2 years ago. Then how do you know so much about anatomy and surgery? I don't know. It's like the knowledge is just there while I'm in this state. I see what you're doing, why, and how it affects my body. Ethan's understanding went beyond anatomy. He grasped the pharmacology of Dr. Chen's medications, predicted tissue responses to surgical techniques, and even recommended optimal suture materials for different repairs. As Emily prepared sutures for the next phase, Ethan spoke up. Dr. Nguyen, use 3-0 Vicryl for the intestinal anastomosis, but 2-0 Silk is better for the liver capsule repair due to its friability, he said. Emily exchanged a glance with Dr. Nguyen, who nodded, impressed. Ethan's recommendations were not only accurate but showed a deep understanding of surgical tissue handling. Even more unsettling was Ethan's ability to know things he shouldn't. As the surgery continued, he started mentioning details about other hospital activities beyond his access. Dr. Nguyen, the patient in OR1 is having issues with their appendectomy, Ethan said during a lull. Dr. Patel will need to extend the incision due to unexpected inflammation. Emily quietly checked with the charge nurse via the intercom. Sure enough, OR1's patient was facing complications, and Dr. Patel was preparing to convert to an open procedure due to severe inflammation. Emily was now certain this was the same phenomenon she'd seen in Syria with Sergeant James Sullivan. Back then, she couldn't report it, too bizarre, too inexplicable. But now it was happening again. Ethan, what do you do for a living? Emily asked mid-surgery. I'm a factory worker, Nurse Emily. I operate heavy machinery. Any medical training? Do you watch medical shows? Nope, Ethan replied. Last time I was in a hospital was when my son was born 2 years ago. Emily met his gaze. Ethan, how would you describe what you're experiencing right now? It's hard to explain, Nurse Emily. It's not normal. My consciousness feels like it's left my body. I can see everything from a different angle, not just this room, but other parts of the hospital too. Dr. Nguyen completed Ethan's surgery over 3 hours, repairing his liver, salvaging his spleen, and closing intestinal tears with precise anastomosis. Ethan's commentary throughout was consistently accurate and helpful. But as Dr. Nguyen began closing his incision, something even stranger occurred. Dr. Nguyen, I'm starting to return to my body, Ethan said suddenly. I can feel my consciousness settling back into my physical self. What do you mean, Ethan? Dr. Nguyen asked. My awareness was floating above, around the room, but now it's coming back. I'm starting to feel my arms and legs again. As he spoke, his vitals shifted, heart rate climbed, blood pressure rose, and his responses began resembling a patient emerging from anesthesia. Dr. Chen, are you adjusting his anesthesia? Dr. Nguyen asked. No, I haven't changed a thing, Dr. Chen replied. But his responses suggest the anesthesia is wearing off naturally. Within 10 minutes, Ethan transitioned from his extraordinary state to typical post-anesthesia drowsiness. His speech slurred, and the uncanny awareness and knowledge vanished. Ethan, can you still see the room from above? Emily asked as Dr. Nguyen finished closing. No, Nurse Emily. I'm back in my body. I feel exhausted, like I just had major surgery. Ethan was moved to the surgical ICU at 7 p.m. for recovery monitoring. His vitals were stable, and the surgery appeared successful, but Emily was shaken by what she'd witnessed. The next morning, she visited Ethan in the ICU. He was awake, alert, but showed no trace of the remarkable awareness from the OR. "Ethan, do you remember anything about your surgery?" Emily asked. "Not much, Nurse Emily. I recall talking before I went under, then waking up here in the ICU. Do you remember being awake during the surgery?" Ethan frowned. "Awake during surgery? That can't be right. I thought I was out the whole time." Days later, unable to keep silent, Emily pulled Dr. Chen aside. "Michael, I've seen Ethan's case before," she said. Dr. Chen raised an eyebrow. "What do you mean?" "Syria, 2020, with Sergeant James Sullivan. Same thing, full consciousness despite anesthesia, impossible medical knowledge." "Emily, you have a military background?" She sighed, no longer able to hide it. "Army Medical Corps, 14 years. Iraq, Afghanistan, covert ops. I specialized in abnormal medical cases." Dr. Chen paused. "And you've seen this before?" "Once, with Sullivan. I couldn't report it, too unbelievable. No one would have taken it seriously." "How do you explain Ethan's condition?" Emily hesitated. "I don't know, but military records called it traumatic out-of-body awareness. Rare, barely documented. It's like consciousness detaches from the brain." "Is that even possible?" Dr. Chen asked. "Not by conventional science. But after Sullivan, I started wondering if our understanding of consciousness is incomplete." Ethan Carter returned to his factory job, fully recovered, with no memory of his extraordinary experience. Dr. Nguyen and Dr. Chen adjusted their anesthesia protocols, now monitoring consciousness states more closely. Emily launched a research project on consciousness anomalies, and Ethan's case was documented as anesthetic dissociative awareness in medical literature. "The most profound discoveries often stem from the unexplainable," Emily noted. Ethan's case reminded her that consciousness remains a frontier science barely understands. Have you ever wondered what happens to your mind during surgery? Where does your consciousness go? Share your thoughts in the comments. Here at Untold Mysteries, we believe even the strangest medical phenomena can deepen our knowledge. If this story resonated, share it, subscribe, and help us uncover more. Until the next mystery, remember, your next surgery might reveal secrets about consciousness medicine can't yet explain.